So good morning, everybody. It's Dr. Jean Fourie here, and today we are going to be speaking about learning problems, and I want to go through a fair amount of the relevant theory that you need to understand as a remedial teacher. There is a lot of confusion and a lot of miscommunication around the ideas of learning problems, learning disabilities, learning disorders, attention deficits, intellectual disabilities. And so we're going to be doing in this lecture and the next one's coming up in preparation for your next assignment. We're going to be looking at all these relatively common childhood difficulties that we come across on a regular basis as remedial teachers. So let me see. So learning disabilities or disabilities in general get categorized and put into little boxes by researchers, by clinicians, people who are in the field. And this field of study changes with time, and it gets refined as more research is done and as people get to understand these phenomenon better. The fields are a variety of different places. So there are health professions involved, there are teachers, speech therapists, occupational therapists, doctors, people from a variety of different disciplines are involved and assist with these phenomenon and figuring out how all of these things can be better diagnosed and how we can better assist children. So if we have a look at some of the areas of disability, there are disabilities related to cognitive functioning. So this has got to do with your intellect, your reasoning abilities, and those are classified as intellectual disabilities, and we will have a look at some of those in the next lecture. There are things like autism, which is a spectrum disorder, and this is related to children and people who have severe difficulties with social interaction, with maintaining eye contact, and with wanting strict routines. So if autism is a highly specific area, which you might also come across children on the autism spectrum. Then we have discussed previously the sensory difficulties with vision, and difficulties with hearing, auditory impairments. And if those are very severe, then there might be disabilities around these impairments where the child becomes completely blind or deaf, or partially blind and partially deaf, and so that becomes a disability. We also have impairments around speech and language, and a lot of that can fall within the framework of a specific learning disability. And disabilities are categorized according to the physical problems that children have, such as problems with walking or problems with their hands, so any orthopedic impairments. Then there are disabilities that relate to any trauma. If the person has been in a car accident and there's been some brain injury, then traumatic brain injury might be um, a cause, a consequence of that. We also have all sorts of disorders related to emotional difficulties, and you all know about depression, people who suffer from very, very severe emotional um, problems, such as severe anxiety or phobias. These are classified in the general emotional problems category, and all sorts of health impairments related to cancers and leukemias and diabetes and all sorts of problems. And we know that, for instance, childhood diabetes is on the increase. And so we are looking at lots and lots of different problems that children might present with. So these are just some of them. And today we are going to look at specific learning disabilities, which is the red block that I have highlighted over here. So when we are dealing with children in this diploma, we are looking very with a focused attention on this category of SLD, specific learning disability. And so that's what I'm going to speak to you about with a little bit more detail today. So specific learning disabilities are classified in the psychiatric manual, the manual that psychologists and psychiatrists use, the DSM-5, the Diagnostic and Mental Disorders Manual. And there are very clear criteria that are given in that manual for psychologists to make this diagnosis. Let me reinforce that teachers are not allowed to make any diagnosis of any medical or psychiatric, psychological condition that children have. So as a teacher, you would see the characteristics, the manifestations of these underlying difficulties, but you are not allowed to say that the child has an SLD unless there is a formal diagnosis which has been received by a person who is qualified to make that diagnosis. So as teachers, we are involved in the diagnostic process, but we do not make the diagnosis. We can make lots of observations, we can do referrals, and we can consult with parents, and we can be part of multidisciplinary teams. But as teachers, we are not allowed to formally write this in your report. So when you're writing your reports for the module on scholastic assessment, be very careful in your conclusions that you do not state the child has an whatever condition. You can only state that there is referral required and that you suspect or that there must be further investigation for possible further learning problems by a qualified diagnostic person, practitioner who's able to do this. Okay, so we're going to speak about SLD, specific learning disabilities, and these are involved with the psychological processes in our brains, in our minds, which allow us to understand spoken and written language. And that is why the word specific is there. So it is very focused on the learning processes that are required in order to understand language. And in particular, we focus a lot on the written language. So this is manifested by difficulties that the child has with reading, writing, spelling, and doing maths. So these are key issues that are being taught at school, and children need to, in our modern world, everyone needs to be able to be literate and numerate. And so these psychological processes are, we teach them, and we have to rewire our certain of the parts of our brains in order to be able to do reading, writing, maths, because we were not uh, evolved as human beings in order to just be able to know the written code, in order to be able to read automatically. So we have to teach these things, and there are some children who really struggle in order to do the schoolwork, and so those are the children that we are looking at that might possibly have specific learning disabilities. So these disabilities are a term that has a lot of different other categories within this whole idea of SLD. And I'm going to go through these so that you have a much better idea when you are reading journal articles, or when you are looking at other reports, or when you're writing a report, because these are terms that as a remedial teacher you come across a lot. So there are difficulties. We're going to start at the top. There are difficulties with reading, and anything that is in any child who is, a lot of children have difficulty with learning to read. However, in order to be able to make this call that the child has an SLD related to reading, and we want to give it the label of dyslexia, then there has to be a severity level that is much greater than the average child. So we are always looking at the teaching that happens, the intervention that the child has had. There must not be any neglect of, the child must have gone to school, they must have had normal feeding, and all the required stimuli in order to be able to have been given the best chance to be able to read. However, despite all of that, they are still having difficulty with learning to read or to write or to do maths or to speak. And so we then start to think, is this condition severe enough in order to give it this label of dyslexia or dysgraphia or dyscalculia, or any of the SLDs? So when we speak about dyslexia, the lexicon is the words. So this has got to do with an inability to be able to decode the written text. And there are all sorts of, there's a lot of research on people who have dyslexia and how differently their vision, what they see on the page, and how that vision is encoded into the visual cortex, that they have different places in the brain that are lighting up during reading, as opposed to a person who does not have dyslexia, where there are different brain waves that are being activated. And so a person who has true dyslexia means that there's something different in the way that their brains are hardwired, so that they're having serious difficulty in order to decode the text and to be able to automatically figure out what the words are on the page. And so these children will often have difficulty with spelling and difficulty with writing words down. And these reading and writing and spelling are often, well, they are intertwined. So generally, if the child's having difficulty with reading, they're also going to have difficulty with writing and spelling. And we often see this in the sequencing, how they will not be able to keep the words and keep the phonemes in the words in sequence. And this is shown in misreading of words and in miswriting of words, because there is no clear, strong pathways in the brain where these sequences are well established. So that's dyslexia. Then dysgraphia is a severe difficulty in writing. And when we speak about writing, there are two aspects that we look at. The one is handwriting difficulties, and that has got to do with actually the motor output of holding the pen or pencil and being able to control the fine motor movements of the writing on the page itself. So there are some children who will have severe difficulty with the legibility of what they're writing. But there are also, when there is an SLD, difficulty with what the content is that is written as well. So that is a different order of handwriting, a different order of writing problems. And that's the difficulty with conceptualizing your words, with figuring out what sentences you're going to write, the order in which the words will appear in sentences. And so it's that conceptualization which also leads to a text that is incoherent and doesn't have a central idea, and it flows badly. So that can also be an indication of an underlying SLD, because organizational skills and the ability to rationalize and put things together is also seen a lot in children with SLD. Then another aspect, and some children might have difficulty with reading of text, but not have difficulty with maths concepts. So, you know, some people have different profiles of which things they're having difficulty with and which things they can do. But any children who are having difficulty with severe, and I'm stressing the word severe here, severe difficulty with learning maths concepts, could have the underlying condition of dyscalculia, where they really have difficulty of figuring out what numbers mean, what the values are, difficulty with manipulating numbers in operations, doing maths and division and fractions and place value. And so severe difficulty. It's a common thing that a lot of people have difficulties with doing maths, but most people have a very good innate understanding if you said to them, what is the difference between one item and 1,000 items? They've got we have if you've got 1 rand in your purse or 1,000 rand in your purse, you have a very good understanding of the value of numbers. Whereas someone who has dyscalculia is having severe difficulty with understanding the value of numbers and working with any mathematical concepts. And then it is a severe thing. So often there might be over diagnosis of dyscalculia in educational systems simply because a lot of people are saying I can't do maths, and it's not a matter of you don't understand the underlying principles of mathematical concepts. It's that you haven't maybe learned how to do higher order things like algebraic equations or complicated algorithms. So when we speak about dyscalculia, it is a severe difficulty. And all of these terms, all of these conditions related to specific learning disabilities must have a high level of severity. So despite good teaching, despite adequate stimulation, and the child has been exposed to, maths, counting and games and puzzles and things and reading. Despite all of that, there's still an underlying difficulty in learning of these concepts. Then let's move on to the next term, which is also falling under this umbrella of SLD, is aphasia. And this is a severe difficulty in conversational speech, in speaking. And these problems, there are just numerous problems that people can have with speech. And remember that in these cases, you should be working with a speech therapist, referring the child for speech therapy to help with these difficulties. So severe difficulties with fluency, with being able to articulate the words accurately, and being able to find the correct words when you require them in a sentence or when you're writing, called anomia. And often these conditions are associated with traumatic brain injury. If someone has had a stroke, if there's some kind of damage, lesion to the brain, to the speech areas of the brain, these things will be seen. But sometimes children will also have difficulties with speech if there are underlying emotional problems. And so we know that stuttering, for instance, might be exhibited in this condition. And if there are conditions of high stress and you asking people to do speeches or a presentation, then those might be associated with fluency and articulation problems. But when we want to put a label on an SLD, this has to be severe. So it must be in all situations, just everyday speech, the person is having difficulty with speaking. So these are indications of an underlying organic problem with the neural networks that allow you to do thinking, and then the motor output of speech and moving of the tongue and mouth and everything required in order to have an output of speech. So if you come across children with these conditions as a remedial teacher, please refer to a speech and language therapist. You could also and should be referring to an audiologist, someone who tests the hearing of the child, because often if there are auditory difficulties, the child can't hear or they can't process information, that also often relates and is manifested as speech fluency difficulties. So this is a vast subject, and there are all sorts of different variations on the difficulties that children might present with in the aphasia speech and language cluster of difficulties. Okay, so I want to go on to the next one, which is dyspraxia. The word dyspraxia, although it is still used quite commonly in education and in occupational therapy spheres, has now been given a formal separate category of developmental coordination disorder, and this is abbreviated as DCD. And when we're speaking about dyspraxia, we are it's an underlying condition of the neural system that does not allow adequate feedback of the proprioception sensory system of the body. So the person is not getting adequate feedback of, for instance, where their feet are from, where their body is positioned in space. And so that results in uncoordinated movements. And so that's why the word coordination is in the title of dyspraxia. So although there's no evidence, so there's no evidence of damage to muscles and nerves from, if you just look at the person, the biofeedback that they are getting from their mouth or their hands or their feet, or just generally all nerves connected to muscles, that feedback is imprecise and not as quick as it should be, so they are not able to be coordinated in their movements. So, for instance, a person with dyspraxia will have difficulty walking up and down steps. So they will not be able to just have this innate understanding of where their feet are, up or down, or get the feedback of their feet on the steps. So often they will need to have strategies like needing to hold onto the handrail and count the steps as they're walking up and down them and focus on it, so they won't be able to speak and do steps at the same time. And that's just one of the difficulties. An inability to have your proprioception biofeedback working will have difficulties with all things. So holding a pencil on the page, there's no feedback of how hard you are pressing down on the page. So handwriting becomes a problem, and it's useful to give these children a very soft pencil, and that paper that's, I think it's called jotter paper. It's got a bit more texture to it, and so you're increasing the resistance of the pen on the page, and this gives a little bit more feedback to the hand so that they can write a bit more legibly, and allowing children with dyspraxia to write in large letters, not doing italicized writing, allowing them to do handwriting that they're able to do, would be part of the interventions that you would do with a child who has dyspraxia. So that dyspraxia is one of those, but it's a highly specific SLD, falling within this big category of specific learning disabilities. So you can see that this term of SLD is quite overarching of a variety of different difficulties that children might have, but they all in general relate to what is happening in schoolwork in order to be able to read, write, do maths, do spelling, handwriting, and so on. Okay, so if you look at some literature, you will also find people speaking about other conditions, such so LD, learning disabilities, other conditions that will be referred to can also be central auditory processing disorder, and this will often be what speech therapists and language therapists will be referring to learning problems in this manner. Difficulty processing and remembering auditory language-related tasks, and it has got to do with the processing in the temporal lobe, which is the temporal lobe of the brain, which processes the sound waves that you are hearing from your ears. So there's no hearing problem. The ears are functioning well, but the person is unable to do that internal auditory processing. So they're hearing what you're saying, but they're not able to make sense of it, to make meaning of it, to be able to figure out what they must do, or what the language, the speech is that has been given. So this you'll sometimes see people speak about central auditory processing problems, and so it's got to do with also this SLD of how we makes meaning of the language that we are hearing from an auditory perspective. And then some children will have difficulty with the next category, which is non-verbal learning disorders. And this is people who are having trouble with reading the visual clues that we are sending out all the time as we are interacting with people. Our body language, our gestures, our facial expressions, all of the things that we are naturally doing as we are speaking or just interacting with the world. Some children with SLD have difficulty reading facial expressions, so they won't know if someone is frustrated, or if there's an angry face, and so this is an area that a lot of therapists will work on to for children to be able to read facial expressions and body language, and we can actively teach that as an intervention. Then some people will speak, let's go on to the third one here. Some people will speak about visual, perceptual, motor deficits. And this also is a general term that is used, but it falls within the SLD category, specific learning disabilities. And if you have a look at the main difficulties associated with visual, perceptual, motor, this has got to do with all the underlying perceptual skills that you need in order to be able to read, to copy things from the board, to be able to cut and to accurately color in. So you're using your eyes in order to see what you're doing, and some kind of motor output in, handwriting or coloring or cutting. And so the difficulties associated with the visual perception. And we've had a lecture on visual perception. And so you have a good understanding of what is required there. So these are some of the terms that you might come across, and I wanted to for you to get an idea of where everything fits in, because these are all they're embedded or included in the SLD overarching umbrella of specific learning disabilities. Okay, so I want to go through now the diagnostic process that a psychologist would be, or a psychiatrist would be going through when you as a teacher refer a child that you suspect has got an SLD to somebody for a confirmation of the SLD. You could also refer to an occupational therapist. Occupational therapists are also able to make the diagnosis of SLDs. So you can, if you're working on a team of people with psychologists and occupational therapists and speech therapists, then between the professionals, these diagnoses can be made. So the DSM-5 refers to the Diagnostic and Statistical Manual of Mental Disorders, and the 5th edition is the one that is currently being used. The SLDs have quite an extensive part in the manual, and this is a summary for you, so that as a teacher you have an idea of what SLDs are about. So the first thing that one looks at is that the child is experiencing severe difficulties in their schoolwork, weak or poor levels of performance. So you can see that it relates to school tasks of reading, writing, spelling, and maths. And these difficulties must be severe enough to warrant additional medical or psychiatric attention. So a child who's just having, a bad day, or there's been some disruption in their life, they've changed schools, or a family member has died, will show a time when schoolwork will decline. But we are speaking here about children who are showing schoolwork difficulties on a continual basis. So they've always had this problem with weak schoolwork. Then the second criteria that's looked at is that there is this discrepancy between what we expect the child to be able to do and the actual achievement that they are showing at school. So the child will be developing according to normal developmental milestones of physical milestones of crawling and walking and running, within those developmental levels. They will have learned language adequately. By the age of 2 or 3 years old, they should be able to speak in their mother tongue fluently. They will have when you look at the child, you are not expecting there to be any difficulties. So they don't have any physical difficulties. There's that you're expecting the child to do well at school in order to be able to learn. So there's this discrepancy between their oral language. They've learned language, but they are not able to take that language and now learn the additional skills of reading, writing, and maths that we are wanting. So this is where one has to be careful and consistent in making the diagnosis. Then the third thing one looks at is that there are difficulties present in what is called the psychological processes related to learning, and the five main psychological processes are perception, attention, memory, organization, and metacognition. So these processes are they're psychological, mental processes that we need to have intact in our minds in order to be able to use our neural networks to do the learning that is required at school. And the fourth one is that one is ruling out any difficulties that may be caused by other conditions. So there's no visual impairment. The child is able to see. There's no difficulties with the eyes. The child is able to hear. There are no difficulties with ears. Ears are able to hear sounds adequately, particularly sounds related to conversations. There's no difficulties with motor output. So they're able to walk, they're able to hold a pencil, they're able to hold a scissors, hold a page. There's no cerebral palsy. There's no other major motor problems. And there's no mental or emotional underlying difficulties, no severe anxiety. Anxiety is often a secondary effect of a child having an SLD, but there's no major schizophrenia or some of the other very severe difficulties. And then we look at environmental factors. Has the child had adequate nutrition? Have they been well fed, well clothed? There's no medical conditions. There's the environment in which the child has been growing up has been conducive to the child being able to do the learning that is required. And they've been exposed to text. They've been exposed to reading. Parents have read books to them. They've had exposure to counting and numbers. But despite all of the adequate environmental factors, the child is still not able to learn to do the reading and writing required at school level. So there must be no other reason why the child is not developing and achieving these academic standards. No other primary influences affecting the learning process. So if one finds any of these other conditions, then it is then it is difficult to make the diagnosis of SLD because there are other extenuating factors that are impacting that diagnosis to be made. Okay, so I'm going to I just want to let you know that I have put up a series of videos related to this SLD topic in the Moodle unit on SLD. And there is a lot of readings that you can go and have a look at in the that have been added. And you need to have a really good understanding of what the SLDs are about, because this is what you're going to be spending a lot of time doing as a remedial teacher. So I'm not going into any of the ways that we assist or the interventions, because those are covered in your other module on learning support and parental involvement. So I'm going to stop there, and I'm going to open the floor up for a bit of discussion. We have a little bit of time and we can deal with some questions and queries, because this is quite a complicated topic and it usually takes people a little while to get an understanding of all this terminology and to figure out where everything kind of fits in and what it all means and how you're going to use it in your practice as a remedial therapist. Okay, so I'm going to go back to the chat, and you're welcome to write some comments for me on the chat so that I can see if I can assist in that score. Okay. Okay. Okay, so Lisa, you have said, in terms of the diagnostic criteria for SLD, if there are other issues like environmental factors or psychological factors causing the symptoms of an SLD, that does disqualify the learner from being diagnosed with an SLD. Okay, so this is really where it becomes very complicated for the practitioner who's doing the diagnostics, because they need to be able to work out, is the child experiencing the SLD as a secondary influence because they haven't had adequate environmental stimuli, or is there really some underlying connection problems in the brain? Because we know from brain imagery, brain imaging that has been done, that the SLDs, children with real SLDs, their brains really are wired differently, so they function differently. So somebody might then give they might say that the symptoms of a learning problem are secondary to the underlying emotional or environmental problems that the child is having. So it's really, really complicated to make these diagnoses when there are various other factors that are impacting the child's development. And sometimes we don't get a clear diagnosis, and so then you could say that there are indications of these learning problems, and one puts these indications in the report as characteristics that the child is showing. And then you want to know, how do you deal with this on a practical level? Well, as a teacher on a practical level, you are going to be seeing the child not able to read, not able to write, not able to do maths, not able to spell. And so your interventions would be the same kinds of interventions. You would be giving, whatever you can in order to facilitate the child learning these particular skills, even if you don't have a clear diagnosis for the child. Where it does impact is if the learner needs to have an LSEN number, a special needs number in the Department of Education, in order for the school to get additional resources. Children need to have a clear diagnosis, and so they need to get a specific number, a special needs number allocated to them. And so often the diagnosis will be made as an SLD in order to get those additional resources allocated to the full service school or the special needs school. But from an absolute theoretical perspective, sometimes it's not a true SLD, but it is an SLD that is manifested because of the underlying environmental conditions that were inadequate during development. So it is quite, it is a complicated field to deal with. Okay. Nick Cooper, you have a question. You said, do I understand correctly that we are going to continue this unit in our next lecture? So I'm not sure exactly, but I think the next lecture is about intellectual disability, or it could be about ADHD, one of those two. So the next lecture is not continuing on SLD. We're going to look at one of the other disorders in a little bit more detail. Okay. Then Karen, you've said that often SLDs and attention problems go together. Yes, they do, because attention is one of the 5 major psychological processes that is required in order to be able to learn. And so often a child who has severe ADHD or ADD, attention deficit hyperactivity or attention deficit, often a child with that as their main focus of difficulty will manifest learning problems because they're not able to attend to the task. So they're not keeping their attention on what they need to read or what they need to write or the maths problems that they need to do. And so the attention deficit contributes to the SLD. And often it's easier to make a diagnosis of ADHD, and we'll go through some of those criteria in another lecture. There might even be a lecture on your Moodle about that. You can have a look. So you want to know, so that do they sort out the ADHD first and then see if the other factors remain? So yes, they often do, and that is because ADHD is easier to intervene with because you can give the child some kind of medication, and there are a variety of different stimulants that are the stimulants that are the medication that's given for ADHD. And those like Ritalin, Strattera, Concerta, the various other homeopathic ones as well. And so often it's much easier to fix or to give some interventions for the ADHD. And then if the child's being assisted to attend, then that often helps with the SLD as well. But sometimes, even if the child's able to attend, for a long periods of time, you still will find that they're not unable to read. And like dyslexia, you will see that children will complain. Some children will complain that the words on the page move around, or they swim, or there's wiggly lines on the page. So that is a visual perceptual problem, and that can't be medicated. So that needs to be assisted with like those little reading windows that you put on the text, or with a colored overlay, or with some other kind of intervention assisting the child with that. So these conditions all go hand in hand: SLDs, reading problems, ADHDs. They are very much intertwined. Okay, so I hope that was useful. Oh, I see there's some more over here. Let me just quickly do this one because we're now going into the next lecture. Rachel, you want to say that at your school you have problems with left-handed children who cannot write. Give pointers on how to assist as they are classified as SLD. So a child who is left-handed is not necessarily called an SLD, but there are lots of difficulties associated with being left-handed. If you have a look on my YouTube channel, I have a lecture on assisting children with left-handedness. And so I might just actually put that in your Moodle, a link to that in Moodle for you as well. So there are all sorts of ways to help children with who are left-handed, because our society is a right-handed society. And so that is definitely, you're going to be assisting left-handed children in your remedial practices. Okay. Mr. Dion, thank you for assisting there with the question from Nix, and you've put in a link to the assessment unit over there. Okay, so I'm going to stop the recording now, and we are going to hand over to the next lecturer. Just give me a minute.